Hello, my name is Anna Wu, and I'm a general surgery resident at Albany Medical Center. I would like to thank the Pediatric Trauma Society for the opportunity to present our work entitled Pediatric Evidence-Based Imaging Guidelines Significantly Reduces Radiation Exposure to Injured Children. There is a strong consensus amongst pediatric surgeons that overuse of CT imaging based on mechanism of injury does not alter management for injured children, and that it is safe to be judicious in ordering CT scans for these patients. It has been demonstrated that pediatric trauma centers have been more successful in limiting radiation exposure to pediatric trauma patients than adult and combined adult and pediatric centers. Our goal was to develop and implement evidence-based guidelines for pediatric imaging at our institution, which is a combined adult level 1 and pediatric level 2 trauma center. We developed our guidelines for obtaining CT scans from existing clinical studies, which were implemented on October 1st, 2018, and distributed to all members of the multidisciplinary pediatric trauma operations group. Non-compliance was addressed with providers within 1 week of the initial patient evaluation. We then captured patient data for patients younger than 15 years of age for 1 calendar year pre-guideline, which was 2017, and post-guideline, which was 2019. Outcomes were overall number of admissions, number of patients transferred from other hospitals, proportion of children admitted to the trauma service, mean injury severity score, length of stay, number of CT scans, and missed injuries. We found that there were comparable numbers of total patients seen and patients transferred in from other hospitals in both groups. The differences in age and gender were not statistically different between the two groups. Length of stay was not statistically different. The mean number of CT scans per patient fell by over 50%, from 0.93 to 0.45. The mean also fell by over 50% for patients admitted to the trauma service, 1.82 versus 0.76. The number of patients who received more than one CT scan decreased from 26 to 10%, with a more significant decrease for those admitted to the trauma service from 52 to 17%. Only one injury was missed at initial admission, a non-displaced skull fracture, which was clinically insignificant. In conclusion, we found that implementation of evidence-based guidelines eliminates the disparity in reducing unnecessary CT scans between combined adult pediatric and standalone pediatric trauma centers. Our findings are consistent with previously published literature which has looked at reducing CT scans in isolated parts of the body, for example, CT head or CT chest. It is important to note that frequent and timely follow-up for clinicians who are non-compliant with their guidelines was critical to our success, which may not be practical for a larger trauma center. The limitations of our study were an inability to determine whether patients were receiving more scans at outside hospitals, which may have decreased our imaging rates, and a finding that the injury severity score was slightly but significantly lower in the post-implementation group. We theorize that this finding might be due to capturing fewer subclinical injuries that would otherwise be detected on CT scan, leading to a lower calculated injury severity score. Further steps include implementing these guidelines at our referring centers and following up to determine if we were able to prevent unnecessary CT scans for children in our region. Thank you.